there's hardly anything more satisfying than boldly stepping in and finding our own healing and helping others with the same. Karl Humiston, MD, psychiatrist, holistic medicine, retired from that in my 60s, and now, ever since then, I'm 88 now, I'm still working as a Rolfer, restoring people to their original organization. When you get to healing people, there are two things you do. You restore their behavioral connection, their conscious connection with their body, and if there are evil spirits in, they have to leave. And the other is you detoxify, cleanse out the toxins, the yeast being the commonest one, but it can be food allergies. I remember in my training in the food allergy work, in a specialized hospital unit, seeing a woman there eat the food that she was allergic to, and wham, for 20 minutes, she was screaming, anguished, agitated, wanting to kill herself for about 20 minutes, and then the reaction cleared up. So her serious depressive disorder was a food allergy thing. And eliminating that food, she had no more of those depressions. And that doctor has always been an outcast in the medical profession because that's called unscientific. Unscientific means, what it really means in practice, it means not supported by drug grants, which are now the major source of funding for medical schools. And of course, they don't support teaching people to get their bodies back. Now, I'm talking about chronic disease specifically. Now, when my hernia surgeries at age 65 and 70, and my cataract surgeries in my 80s, they work just fine. I mean, but that's not like something like diabetes. The medical board here in New York got mad at me for telling people I could clear up their diabetes. It's not hard to clear up diabetes and stop being diabetic. You have to detoxify the person. And then the pancreas can recover and start making insulin again. But in the medical world, diabetes is officially incurable, and it's considered unethical for a physician to claim to cure a known incurable disease like diabetes. Well, and it's much harder to fight this now than it was in my father or grandfather's day, because now that all payment comes through one solid system, more or less, they don't get paid unless they use an approved treatment for an approved diagnosis, and the approved treatments are drugs. And detoxifying is not an approved treatment. The medical profession is incapable of thinking that way, because payment is for an approved diagnosis for which you give an approved treatment, which is a drug. Now, a comment on so-called evidence-based medicine. Today's medical profession prides itself on being evidence-based, which means they use diagnoses and treatments which are scientifically standardized, approved, validated. Well, back in 1995, living in Oregon, I was an AARP lobbyist. And on the state legislative committee, chairman of its healthcare subcommittee. And there was a bill passed, there was a bill introduced to stop the medical licensing board from revoking medical licenses of doctors who used alternative medical treatments. And I understood this. For 8 years here in Manhattan, 1980 to 88, Bonnie and I had run the Humiston Holistic Health Center doing just that. we saw about 3,000 patients in that 8 years, most of whom had chronic, serious disease, diabetes, arthritis, asthma, migraines. And we got good results in about 80%. We became experts at tracking down what the toxins are. The toxins were food allergies, yeast, or intestinal parasites, amoebas and giardia, or worms. Things like asthma and migraines very commonly come from intestinal parasites. So I took charge of the lobbying for the bill because I knew what needed to be said, and I'm the one that testified to the Senate committee hearings in the state legislature. Mr. Chairman and members of the committee, the standard medicine that this board, I pointed to the board members in the room, hoping they would shrink, supports, is based on clinical research where the drug in question is tested meticulously, carefully, methods, so that you can validly conclude that it really does help most people. How many is most? They didn't know. Well, I did. I've been reading the published reports of drug studies for psychiatric drugs that have been approved by the FDA to see what kind of evidence the FDA used for the approval. So I read those articles, as boring as can be. But I knew what I was looking for, and I found it. It would show a bar graph, like this, different ones at different heights, showing the percent of patients who were helped by this drug, this drug, this drug, and this drug. And the one that would win always came in at about 2/3. Now, it's not easy to come up with a synthetic chemical that does more good than harm if you eat it. And I think that if they can show 2/3 good results, that's the threshold. Because why did they all come in at about 2/3? Anyway, they did. So I said, well, I'll tell you, it's about 2/3. Which means, Mr. Chairman and members of the committee, that the standard medicine that this board supports, their best research proves that their best drugs fail to help 1/3 of the people for whom they're intended, who therefore need an alternative which usually helps them. Because that's what the issue was, protecting the practice of alternative medicine. And I knew that it did because I had been doing that here in New York. And I said, this means, Mr. Chairman and members of the committee, that by taking out doctors who provide that alternative, this board is depriving 1/3 of your constituents of the care they need. The bill passed the committee unanimously, passed the Oregon Senate unanimously. It's unheard of. Unanimous? Well, yes. The legislators loved this bill. I found out later that they were pissed off at the medical board for some other issues of arrogance, so it was the right time to do this. And then it passed the House with one dissenting vote. And I went to his office later. Why did you vote against it? And he said, oh, I had a friend once that went to an alternative doctor and it didn't help him. Oh. Now, evidence-based medicine would include a requirement that a hospital, a clinic, a doctor look for, if there's a procedures book, which there is in hospitals and places like that, the policy manual, that there would be a procedure in place for identifying those patients who are not being helped by the drug in question and find an alternative for them. But they don't do that. They call their work evidence-based because it's using drugs that have been proven effective in the treatment of the thing, You notice they don't claim that it helps the patient, only that it's been proven effective in the treatment of it, the depression, the arthritis, the diabetes. Real evidence-based medicine would pay attention to the evidence, which says that there's a third of your patients not going to be helped by this drug, and they need something else, and you're not giving it to them. So I'm a radical, right?